On this Monday night, the countdown to Ontario's lockdown. Strict new protocols are coming to the entire province.
This is an extremely serious threat.
The backlash from Canada's capital city. The UK in isolation. No one's allowed in or out.
It might be a little too late.
Canada's plan to avoid a mutated strain of COVID-19. Accommodating adults. The pediatric ICU being forced to pivot. And the difficulties for doctors and nurses.
It's gut-wrenching.
Plus, underpants, a nerve agent, and a Russian spy. Uncovering the plot to poison a Kremlin critic.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. As Global News first reported last night, Ontario is going into lockdown. 28 days for most of the province, 14 days for the north. But it doesn't go into effect until Boxing Day. Ontario has one of the worst COVID-19 caseloads in Canada. For the past week, more than 2,000 new cases a day. But in the nation's capital, where case numbers have already dropped off, there's a feeling there's no reward for abiding by the rules. Eric Sorensen has our top story tonight.
This is the problem. Ontarians still interacting with too many people outside their homes, shopping, at work, and in other gatherings. It's led to a looming crisis for hospital beds, especially in southern Ontario, and to a rising death toll once again in long-term care homes. So, a lockdown is coming the day after Christmas.
Make no mistake, thousands of lives are at stake right now. If we fail to take action now, the consequences could be catastrophic.
On December 26th, Ontario's limited lockdown goes province-wide. Non-essential businesses will close to in-person retail till January 9th in Northern Ontario and till January 23rd in Southern Ontario. Schools will reopen later in Northern Ontario and for elementary schools in Southern Ontario on January 11th. High schools in the South will do remote learning till the 25th. Childcare and grocery stores can remain open. Restaurants and bars can open for takeout. Hardware and pet stores can stay open for curbside pickup. One administrator drove home the urgency for his hospital network in Toronto and Brampton.
I can tell you that the surgeries that we are cancelling are people that have been waiting for certain surgeries in pain for 2 to 3 years.
Indeed, the stress on hospitals is increasing. Latest modeling shows Ontario's ICU occupancy will be over 300 beds within days and could rise to over 600 or higher in January, potentially overwhelming some hospitals' capacity to care for serious illnesses and accident victims.
We're in a very, very challenging and precarious situation.
Public health officials are fully behind a stringent lockdown.
We don't believe anything less than 4 weeks will be effective, and longer durations will be more effective.
Regions like Ottawa are doing better than Toronto, and some there aren't happy with a full lockdown.
It's a little bit of a kick in the gut, I would say. We've been doing really hard work here in Ottawa to get our numbers in line.
The business community, along with the residential community, as Dr. Etches pointed out, have been working very, very hard, following the rules, only to be surprised and, as I said, blindsided by the province.
But if Ottawa stays open, the province fears more people would stream in, from Quebec, for example.
Nothing against Quebecers. I love the Quebecers, but they'll come over in droves. We're acting, we're being decisive, and I'll always listen to our health experts.
Even before the lockdown, the message from the province is, if you can, just stay home. It will reduce the number of COVID cases sooner. Eric Sorensen, Global News, Toronto.
Canada has joined the list of countries now banning travel from the United Kingdom to keep a new strain of COVID-19 out. It's more contagious and is responsible for a wave of new cases in the UK. Now, there's no evidence that it has reached this country, but in Europe, there is concern because people have been traveling. Here's Crystal Goomansingh on the world strategy to isolate Britain.
No entry. That's the message being sent to Britain. Truckers who normally haul goods between England and France have been shut out.
I come twice a month to England and go back. I take freight to England and freight to Poland, but such a situation is very stupid.
A new strain of the coronavirus is spreading in the UK, and other countries fear it'll be imported. More than 40 countries have implemented some type of travel ban. Canada suspended flights until at least Wednesday.
In reality, at this point, it might be a little too late, right? This variant was first identified in September, and there was some travel between individuals in the UK to other countries.
It has been identified in very limited numbers in countries including Australia and Iceland. However, it is spreading fastest in England.
The new variant is out of control, and we need to bring it under control.
Another lockdown was imposed Sunday on roughly 21 million people in London, southeast England, and Wales. The World Health Organization is urging calm.
So this situation is not, in that sense, out of control, but it cannot be left to its own devices, either personal behavior or the virus itself. As we learn more about the virus, we'll learn more about how it may replace other strains, and that, as I said, has happened before.
This mutation, like the others, does not appear to cause more severe illness, and vaccines should still be effective. Crystal Goomansingh, Global News, London.
The Alberta government is asking all travelers who have arrived from the UK in the past 14 days to get tested for COVID-19. Those travelers are also required to quarantine for a full 14-day period. They're not eligible for the border pilot program that reduces quarantine time. Anyone who has arrived from the UK will be contacted by Alberta Health Services to book a test. COVID patients are flooding into Alberta hospitals in Edmonton. The situation is so critical, the Children's Hospital is now preparing to care for critically ill adults. As Heather Yourex-West explains, medical experts say, wait for it. The worst of this wave is still weeks away.
When Brittany Bodner heard adult COVID patients were being moved to Edmonton's Stollery Children's Hospital, she says her heart dropped.
Anytime that I have a moment to reflect on our experience, I'm quite honestly brought to tears. I couldn't be at her bedside. It was devastating.
Bodner's baby daughter Sage spent 4 months in ICU last spring following 3 heart surgeries. COVID protocols during the first wave meant only one parent could be in the room at a time, with no place to sleep. Alberta's second wave surge means those policies are now back again.
As the demand for the ICU beds are increased, we are being called on to give up some of that space so that the adult care teams can move into their.
With COVID patient numbers swelling, Alberta Health Services is scrambling to expand capacity in the province's hospitals.
The problem is people are people, and everybody wants to get back to their life. And right now, we're paying a price for that.
How it started, how it's going. Photos shared by Dr. Markland painting a pretty clear picture of how many ventilators are now being used by COVID patients at the Royal Alexandra Hospital.
There are a percentage of those people who go on ventilators that end up never coming off. People get initially better, and then they get this secondary injury that slowly turns their lungs into concrete. And it's like concrete slowly setting. And those people become dependent on the ventilator to the point where we actually can't push the air in and out of them anymore.
Personally, almost every single day last week, I had at least 1, if not 2 or 3 deaths. It's incredible how much death we're seeing.
With no choice right now but to carry on, knowing that any kind of relief is still, at best, weeks away. Heather Yourex-West, Global News, Calgary.
The NHL says it will return to the ice in January. The league and the Players Association agreed to a 56-game season that includes an all-Canadian North Division. But all 5 provinces need to sign on, and today health leaders in BC gave no assurance.
This is an intense time. The NHL has provided what they're proposing to do, and now we'll take a look at it and we'll see.
All of us need to be on the same page about how we're going to manage this. We've given options back to the NHL, and we'll be looking at things again.
Dr. Bonnie Henry says BC is not the only province that has expressed concerns over the league's proposal. In a statement, the NHL says it is aware of the challenges ahead and will continue to prioritize the health and safety of participants and communities. Undercover work to uncover the truth. Coming up, Russia's opposition leader gets to the bottom of how he was poisoned. Plus, roaring with lava, the eruption and earthquakes in Hawaii. U.S. President Donald Trump is rarely seen in public anymore, despite thousands of Americans dying from COVID-19 every day. In just 30 days, though, Joe Biden will be inaugurated as the next president of the United States. Tonight, our Jackson Proskow looks at Trump's final and desperate days in office.
Still inside the White House, but rarely seen in public, President Donald Trump has spent his final weeks scheming to overturn the election he lost.
We have uncovered a voter fraud, the greatest voter fraud in history.
Those baseless claims have met fierce pushback.
To this point, I have not seen a reason to appoint a special counsel.
From outgoing Attorney General Bill Barr, who shot down the suggestion from some Trump advisors that the federal government seize voting machines from the states.
I see no basis now for seizing machines.
But Trump is still fixated on the election, reportedly asking advisors whether he could use the U.S. military to rerun the vote in key swing states, all the while absent from the real crises facing the U.S., like a large-scale cyber attack on U.S. government infrastructure linked to Russia, an economy wrecked by more job losses and already high unemployment, and a surge in COVID-19 cases, with thousands of deaths every single day and a growing shortage of hospital beds in the hardest-hit states.
It's extremely bad. There's no, questioning how bad it is anymore.
President-elect Joe Biden received his coronavirus vaccination on Monday and urged Americans to hold out hope that things will improve.
This is great hope. I'm doing this to demonstrate that people should be prepared when it's available to take the vaccine.
The challenges facing the U.S. will only grow worse between now and Biden's January inauguration, a period marked by an unprecedented absence of leadership. Much like Trump, the White House coronavirus task force has also largely disappeared from public view. And just a few days before Christmas, there has been no coordinated federal guidance about avoiding travel or other potentially risky situations. Robin?
Jackson Proskow in Washington. Thanks, Jackson. Russian opposition leader Alexei Navalny has duped a spy into revealing how he was poisoned. It turns out the deadly nerve agent Novichok was applied to Navalny's underwear. He wore the poisoned pants the day he boarded a flight to Moscow and fell violently ill. That was back in August. As part of a Bellingcat investigation, one of the operatives allegedly involved in the assassination attempt revealed the plot when Navalny phoned him and tricked him into thinking he was someone else. Russia's Federal Security Service calls Navalny's actions a provocation. A British court has found 2 men guilty of manslaughter in the deaths of 39 Vietnamese migrants who suffocated in the back of a container truck. The horrific discovery was made in October 2019. The victims, between the ages of 15 to 44, were smuggled into the UK from France, inside a sealed trailer that heated up to 38.5 degrees. Some called family back in Vietnam to plead for help as they ran out of oxygen. George Nica from Romania was an organizer of the smuggling operation. The driver, Eamon Harrison from Northern Ireland, claimed he didn't know there were people in the trailer. Both will be sentenced in the new year. Still ahead, after years of promises, why are clean water projects still a struggle for several First Nations?
You're watching Global National.
The lava poured out of the Kilauea volcano following about 7 earthquakes on Hawaii's Big Island. A 4.4 magnitude earthquake then followed the eruption. It has now stabilized with no reports of significant damage or anyone being hurt. In 2018, a major eruption forced many residents to leave their homes. About 700 homes were destroyed. Kilauea is the most active of Hawaii's 5 volcanoes. Members of the Neskantaga First Nation are finally home after a 60-day evacuation, but their water is still not safe enough to drink. The community's water was shut off in the fall after an oily sheen was discovered in the reservoir. Upgrades to the water system were scheduled to be completed in 2018, but residents are still waiting nearly 3 years later. And now an investigation by Global News, APTN, and the Institute for Investigative Journalism has found Neskantaga isn't the only First Nation to encounter issues with contractors. Catherine Ward reports.
When you arrive in Neskantaga First Nation in Northern Ontario, you can't help but notice the signs. The community here has been under a boil water advisory since 1995. The longest in Canada.
My daughter, she's 23 years old and never had clean drinking water.
Kingdom Construction Limited was hired in 2017 to construct the upgrade to the community's water treatment plant and distribution system. The goal, make clean drinking water available by May 2018. However, after an 8-month delay, Neskantaga terminated the contract. The federal government has invested $16.4 million to date, but residents still cannot drink the water.
You hate to see your relatives, your children, your future living in this condition, and there seems to be no end.
In the fall, Neskantaga leaders called for an investigation into the business practices of the contractors and engineering firms that worked on their water system. Global News and its partners have spoken to 4 other First Nations who allege Kingdom Construction delivered work that was incomplete, late, and over budget. Indigenous Services Canada acknowledges issues with the conduct of some firms, but wouldn't address specific allegations against any one company.
Neskantaga is a particularly acute example of that. Is there are issues with third-party contractors and spotty records and sharp practices. And as you see across Canada, you have contractors that don't necessarily behave well.
This is Ryan Tababadung's community, Wasauksing First Nation along Georgian Bay. Kingdom Construction was also hired to build a water treatment plant here in 2010.
It was pretty early on that we received a request for an extra.
Do you remember the cost?
The ask was over $1 million.
Tababadung says even though the project was finished in 2012, it was delayed by 11 months and over budget. In a phone interview with APTN's Melissa Ridgen, the president of Kingdom Construction said his company wanted to avoid First Nations projects in the future.
We just don't want to go back to native work anymore. And the reason is it's just too complicated. There's too much politics, too many players. Everybody's trying to cover their butt, and it's very complex.
Landry later apologized for the language he used and acknowledged that it was culturally insensitive. Kingdom denies any allegations that its work did not meet the highest standards, including in Neskantaga, adding that in any project there can be unforeseen expenses and potential delays, and that additional costs are always approved by the design engineers based on the facts on the ground. Catherine Ward, Global News.
Up next, the doctor who has tackled Canada's health crisis as well as his own. An off-duty rescue worker in Thailand was called into action to revive a baby elephant. A motorcycle knocked the animal to the ground and it was losing consciousness. But after several minutes of CPR, the baby managed to stand up on its own. It eventually made its way back to an adult elephant, presumed to be its mother. Throughout this pandemic, healthcare workers have been putting their own lives on the line. One of them is Dr. Michael Gardam. He's been through many health emergencies, but nothing as extensive and dangerous as COVID-19. It's a lot of pressure to be responsible for the health of the public. And then Dr. Gardam had his own scare. As Jeff Semple reports, he had to make a major decision.
As COVID-19 cases climb again, staff on the front lines are worrying less about infection than exhaustion.
Each day brings a new potential COVID outbreak.
Dr. Michael Gardam is no stranger to the pressures of a public health emergency. Gardam was on the front lines of the SARS outbreak in 2003, H1N1 in 2009, and Canada's response to Ebola in 2014.
If there's lots of virus in the room, got caught with their pants down. Certainly if you have a lot of cases of flu out there.
He's given countless media interviews, providing a calm hand in the storm.
There was so much fear. And when you're the person who's advising on what to do and you're in all those meetings and you're speaking to people in the media and you're getting hit with these waves of fear, that is exhausting.
So this is our COVID-19 tile.
In the first wave of COVID-19, Gardam was chief of staff at this Toronto hospital. During a shift back in May, he suddenly felt a pain in his chest.
As a physician, you spend your first 10 minutes running through a list of things that this could be in your head and then thinking, this can't possibly be cardiac.
But as he stumbled into the emergency ward, he realized that's exactly what it was. Gardam was having a heart attack, caused by a blockage in his left anterior descending artery, morbidly nicknamed the Widowmaker.
Talk about access to healthcare, right? I had a heart attack in the hospital. They treated me extremely quickly. If it would have happened the day before, I wouldn't be here.
Now, 7 months later, Gardam, a former marathoner, has made a full recovery and a life change. In October, he moved out of the big city to the ocean on Prince Edward Island.
The level of chronic stress and anxiety, which I think was compounded with the pandemic, that was like a major wake-up call for me.
He's still working full-time, often remotely, and at 56 says he has no interest in retiring. And this is no time to back away from a fight.
I know that there's been some pushback about using war analogies. You know, the way I look at it is that it's kind of like we're in 1944 right now. You sort of think that you can see an end to this, but it's not going to happen tomorrow. And we've got months of slog to get there. And you can't stop. If you stop, you're going to lose all of the things that you fought so hard to win.
Jeff Semple, Global News, Toronto.
And that is Global National for this Monday night. I'm Robin Gill. We leave you tonight with a once-in-a-lifetime celestial event. The planets Jupiter and Saturn have been closely aligning to form a great conjunction event not seen in nearly 800 years. Together, they form what might appear to be a bright Christmas star. If you're lucky to have a clear sky where you are tonight, you might see it for yourself. Thank you for watching, and I'll see you back here tomorrow. Have a great night.